Pause recording.
Under the guidance of Deepak Bhai and Amit sir and all the uh, well-wisher of DYF group. So today, this is my first attempt to, talk on the uh, big forum like this. Please, I mean, I've prepared for some of the things. If any deviations from or anything you need to correct me, please let me know. Even I'll also learn this. This is a forum for learning. Nobody is, a guru here. Everybody is a learner. Every day is a new thing, new learning curve for us. So today we'll be discussing health insurance. So as uh, as we are all aware that health insurance is one of the most important insurances that one should have. Um, uh, that's the reason we're discussing today. Health insurance is actually a misnomer. It's actually hospitalization insurance in India. So far as Indian scenario is concerned, so it is a hospitalization insurance because the first fundamental point that any insurer will ask is whether there is a 24 hours hospitalization, except certain daycare procedures where the amount is already fixed. So otherwise, for all the medical cases, it's absolutely necessary for the uh, uh, insurance availer to admit in the hospital first 24 hours, it's a minimum 24 hours, or else the claim will not be admitted. Okay. However, in spite of this fundamental point or conditions, so one should have a health insurance. So why one should have a health insurance? So inflation in healthcare is more than 12 to 15%. Okay. Cost of hospitalization, especially in metros and tier 1 cities, is alarmingly increasing. Healthcare is still affordable in some of the tier 2 and tier 3 cities. But however, when it comes to metros and tier 1 cities in India, the cost has enormously increased in the recent past, and specifically after the post-COVID, with increased health awareness in many people, and the catastrophe that the people have experienced in the COVID pandemic. So the healthcare industry as a business also has taken a new height. So, so far as my knowledge is concerned in the healthcare industry, so many of the big players have exited India in the 2000 post 2013-14 because of increased regulation and increased penetration of government sponsored programs. So many of the big corporations, especially the MNCs, have exited the India. However, post COVID, so many conglomerates are entering into the healthcare industry, especially in the metro cities. Okay, so rapid advances in technology and researches has increased the life expectancy, hence the cost associated with this. So there is a enormous research and development is going on in healthcare industry that is prolonging the life of individual, and the amenities to treat has also increased rapidly, both uh, equipment wise, technology wise, and even medical uh, uh, medical advances, so far as medicines and other treatment modalities are available. So that has caused the increase in the cost, and unrealistic expectations from healthcare providers by general public push the doctors for defensive medicine and increase the diagnostic workup. So what I've seen is, so we know that sure, most of the times being a doctor, I know this is what it is. But still parents and patient attenders will keep on asking why you have not done an MRI, why you have not done a genetic test. though we are 100% sure about certain things. And when we were medical students, our professor used to tell, whenever you are doing investigation, you should define why you are doing and what is the outcome, and in what way this investigation is going to change the course of the patient treatment. So because these are the three fundamental things one being a doctor, you should ask yourself before ordering any investigations. However, in the current scenario, so if we don't do investigation, it's not going to add any value to the treatment or to the prognosis or to the outcome of the entire treatment protocol. So still the patients, because of the availability of the information on their mobile, so they keep on searching and asking why have we not done an investigation or workup for that particular condition, though it adds a little value or even no value to the overall outcome of the patient or treatment. So that has pushed the doctors to even to write investigations or workup or any test, any procedure for that matter. So that has resulted in increase in the cost. Fear of litigations, violence against doctors, and establishment has increased the referral to tertiary and quaternary care centers. So no doubt, we even in our own setup, so we know the end result, but the parents or patients keep on asking us the same thing: why can't we go to some other big center? So they have hope or false hope, or somebody pushes them to go to a higher center where uh, they think that the miracle will happen, and uh, that is going to change the course of the disease. So that has again pushed the cost enormously. So that is a reason for one of the few reasons for health insurance. And the one fundamental point I want to tell you is, so even the healthcare provider point of view, they are binded by something called as SOC, schedule of charges, which they are going to healthcare providers are going to enter a contract with a health insurance company. Especially this contract will last from varies from one insurer to the other insurer. It is a minimum of 2 years. So 2 years the healthcare provider has to provide the services at the cost agreed by mutually by both the healthcare provider and the insurance company. And this cost is way below the cash patients. That is my experience. So the cash patients pay very high amount compared to the person who is having a health insurance. So this is a one reason, nearly 25 to 30% less than the cash patients. So this is the one reason why we should have a health insurance. This is based on my experience and what I've seen in India, especially in Bangalore. So these are the diseases, simple diseases, viral illnesses with some dehydrations or enteric fever or dengue fever with little complications like or warning signs, we call it as. So the cost will be the minimum hospitalization will be somewhere around 4 to 7 days, and the cost of involved in small and medium hospital is 35 to 50,000, medium to large 50 to 60, large hospital is 60,000 to 80,000, and corporate it is going to be more than 1 lakh rupees. So simple surgeries like appendicectomy, cholecystectomy, so that is going to cost anywhere between 50 to 1.5 lakhs, and in some of the tertiary care centers it's going up to 2.5 lakhs also. So again, it's pushing the limits of the individual to pay the hefty hospital bills. And my worry is not about these fixed surgeries. Okay, my worry is about the medical ICU. Any patient who lands up in a medical ICU, even for a treating doctor like me, even I feel the pinch of the parents and the patients attenders. The cost is high. So not that the hospital establishments are charging them the more, because the expectation of the patients and the advances that we have seen in the medical field and the cost associated with the manpower. Healthcare manpower is the most intense, and most well-trained manpower in overall industry. Even a sweeper should know how to clean the things, or how to how to be in the ICU. So That's the reason the regular helper we may give 15-20,000, whereas a trained helper will also require around 25 to 30,000 to pay. So the cost involved in the small and medium hospital will be around 15 to 20,000 per day. It's a minimum, okay, apart from investigation and medicines. Whereas in this corporate setup, it will go up to more than 50,000. Okay, so this is the main reason for all of us to have an adequate health insurance, uh, especially for the medical condition. I'm really worried about the medical conditions. Whereas in surgical conditions, okay, there may be 2.5 lakh, 3 lakh. So that is there is a cutoff. Whereas in a medical condition, there is no cutoff. The bills are to the tune of 15 lakhs, 20 lakhs, 25 lakhs. I think it is more than the saving of lifetime saving. So that's the reason it is very important for all of us to have a health insurance. Okay, so next comes, which is the best insurance company. Okay, I primarily handle the one of the small hospital businesses, so I know how the health insurance rejection happened. So my definition of health insurance is at that when we need the most, if that insurance company admits our claim, so that is the most best insurance company. So there is nothing like a best insurance company, because health insurance is a loss making business in India, because the government health insurances are paying nearly 110% of the what the premium they collected. So if, for example, if they collect 10,000 rupees, they're paying nearly 11,000 rupees as a premium, as a claim. So it is basically a loss making business. So one more thing is the claim settlement ratio. That is what with which the most of the people will sell us the insurance policy. So how much per claim is settled is more important. For example, if there is a 10,000 rupees bill, so how much the insurer is going to pay that? What I've seen, typically they pay around 60%. For example, out of 10,000, they're going to pay 6,000 rupees. That's all. So the rest of the payment has to be borne by the uh, uh, patient. Okay, so this is the very important tool, and there is no data that I've searched many places. There is no data I've collected so far with the individual health insurance companies, either with uh, the specific healthcare insurance provider or with the general healthcare insurance provider. I haven't found out this data even after 2 days of searching. So the most important thing that I've noticed is higher the market share, better control over the tariff negotiation with the network hospital. This is the first hand information that I have. So whenever there is a, if for example, out of 10 or 100 patients that are getting admitted to the hospital, if that hospital is receiving nearly 25 to 30 patients of that particular insurer, so the hospital will go for a little lesser price. For example, if they charge 10,000 rupees as a room rent, they can even go for a 7,000, 6,000 rupees for uh, you know for attaching that insurance, because that gives a bulk of the business, so that some way that will compensate the business volume will compensate the price for that particular hospital. So whenever we're buying a health insurance, we should see the market share, because I'm going to tell you why this is very important. So company with a higher network with the small and medium hospital, this is a very very important thing that we should see, because many people will have we have uh, tie up with a X insurance, X corporate, Y corporate, Y corporate hospital. So this the company the insurance company with the highest network with the small and medium hospitals will definitely reduce our the premium payment. Okay, for example, if an insurance has a 5 lakh rupees uh, insurance insurance, so if that particular patient admits in a big corporate, 5 lakh will get vanished in next 4 5 days. Okay, so whereas if the same person is going to admit in a small and medium hospital, well managed small and medium hospital, so this can last for 15 to 20 days. So this is a very very important tool that we should analyze before entering into the buying a health insurance. So so how do we find out this? How we can find out? So in our locality, we can find out the good hospital, because the rapport with the doctor is very, very important. To have a general physician who can take who is taking care of your children or your elderly parents. So you should have a good rapport with the doctor and to understand and extract what are the facilities that are available with that particular hospital. So that will save our lot of money so far as even when we are paying a premium also. So this is the share of the how the various companies, various insurance companies have a overall share in India. So New India Assurance. So it's, even I was shocked to know that New India Assurance has the highest number of insurance policy holders, 18%. The second one is the Star Health. We can see this. So New India, United India, National Insurance, and Oriental Insurance, and totally the 4 insurance companies will nearly form the bulk of the healthcare policies. So, and the Star Health Insurance has a 16% total coverage. So because they have a well groomed network, agent network, so this is they have a 16%. However, this insurance has the lowest claim settlement ratio. Okay, so maybe because of the volume, I don't know, but so far as my first time experience is concerned, though I have a Star Health Insurance, so the number of rejections are more compared to the New India Assurance. So while managing only, I came to know. So most of the corporate clients have a New India Assurance because their services are very good, and their premiums are less compared to, even for individuals, their premium is less uh, compared to other insurance companies. And one important point that I want to emphasize is the government insurance providers have a network called as a GIPSA. It's called a Government Insurance Provider Services Association. So this GIPSA is is a is a very powerful body. Okay, so it it negotiates very well with the uh, healthcare provider. So, for example, if the actual cost of the hospital is 80,000, they will negotiate it to 55,000 to 60,000 rupees. So, because the sheer volume of their business, so that is able to provide them a good opportunity to negotiate with the hospital providers. So, this is how the overall graph looks, and many insurance companies online, especially when we are checking online, so their premium, they quote a lesser premium, but the bigger picture, I'm going to tell you how this is going to affect us in the cashless availing cashless facility. So what is ideal insurance policy? So ideal insurance policy, most important point that I noticed is room rent capping. So most of the insurance companies have a 1% room rent capping. For example, if I have a 5 lakh rupees insurance, I can avail a room of up to 5,000 rupees. So room rent is a very important thing, because room rent includes not only just a room price. This also includes nursing charges and resident medical charges. This we may they may tell the room rent is 4,500. We may opt for a room which is say 4,000 rupees or 4,500 rupees only. But when the bill comes, they are going to add a 4,500 rupees plus 500 rupees as a nursing, 500 whatever amount, 500 rupees as nursing charges, 500 rupees as RMO. So our room rent effectively becomes 5,500 rupees. So so we are opting for a 10% higher room actually, basically. So for example, if there is a 1 lakh bill, we have to pay a 10,000 rupees as a co-payment. Okay, so this is a point that all of us should have a keep in mind. Or most of the for extra premium of 1,000 rupees, we can opt for no proportional deduction terms. So this is there in most of the government insurance. If you opt for a no proportional deduction norms, even if you go for a higher room, higher room rent, there won't be any proportionate deduction in the overall claim. Okay, or we need not pay the extra amount or additional, like whatever the 10,000, 12,000 rupees, that will be waived off here. So no capping on a disease and specific disease and surgery. Okay, so we should ensure that whenever we are reading the entire terms and condition, there should not be any sub disease clause. Okay, and restoration benefit is ideal. However, the number of claims that happens in a year is very less. Repeated claims happening is very less. So there won't be. It is not the must criteria to look into. So minimum of 10 lakh base policy floater is needed in metro and tier 1 cities with a super top up of 50 lakhs with a deduction of 5 lakhs. This is a very important point. Whenever we are opting, we should have a minimum of 10 lakh base and 50 lakhs with a deduction of 5 lakhs, because you know what happens. Room rent capping is 1%. Even if it is 1%, we can opt up to rupees of 10,000. I advise most of the for surgeries, 2 days, 3 days surgery, we can go for a sharing room or even smaller room tariffs. So that will help us in saving our insurances, and and even additional payment that needs to be paid also will be come down if you offer a lesser room rent, lesser tariff room. Okay. So most important thing is buy insurance when you are young, and so no need to worry about the pre-existing disease waiting period. So when we are young, and most of us will not have any pre-existing disease, so that will avoid us in waiting for a pre-existing diseases. Okay, so buy as early as possible health insurance. That will save a lot of things, because once we cross 4 years in once we have continuous 4 years insurance coverage, most of the diseases will be covered. So it's very difficult to pinpoint 2 years, 3 years, 4 years waiting period, because there will be sub clause. Even after reading so much, we will be having sub clause. Okay, this disease will not be covered. This is not covered. So better to have a early health insurance. See, I was emphasizing about the problem with a low premium insurance company. So this is the I'll go with the one surgery here. We can see this peritonsillar abscess. See, this is a 40,000 is a quoted price. So this is the offered price by the insurance company, 9,928 rupees. Can any hospital do a surgery of such a nature for just rupees 9,900? This is the tariff that is issued. I mean, this is the negotiation amount mail that they have sent for 9,928 rupees. Okay, so this is a problem with most of the low premium offering insurance companies. So they'll keep on going to many hospitals to have a tie up with them with a very small amount, and most of the hospitals will neglect them, because as I said, these insurance companies will have a 1 or 2% maximum. In a year they may have a 2-3 insurance admissions. So that's the reason any low premium any low premium, especially if the market share is less, so we're not supposed to opt for that insurance. So this is the claim settlement ratio that I got it from the IRDA website. So New India Assurance has the highest claim settlement ratio of 99.88%. Remember, this is the insurance company which has the highest market share in India. And subsequently, most of the government insurance have a better claim settlement ratio compared to some of the private insurance companies. And in that sense, HDFC Ergo has a good sense, a good the second highest insurance provider, the Star Health, has a 82% claim settlement ratio. Okay, so these are the important points that I want to highlight about the health insurance. And if Deepak Bhai allows any questions, I'm ready to answer, because this because most of us, most of the DIY group are aware of the more basic things of the insurance, but I wanted to add some of the important things that will help in choosing the health insurance or opting to a new health insurance companies. Bye.
Yes, yes, Ravi bhai. Yeah.
Ah, sure,
It
sir.
is so much spoken in the group, na? But if you hold a, what do you say, a
Survey
poll,
or poll?
90% will not have. Most likely, I don't know. We are now 800 plus. Now we see only 36 people join. They think
Oh,
health
okay.
insurance is not for me. लगता है उनको.
Only 1 second.
Bhai, I have questions. So
Yeah, yeah,
ask
yeah, yeah. Please, anyone, anyone.
anyone. Okay.
He's on call. You can,
Yeah, yeah.
you can,
Sure, sure.
let
Yeah,
him finish the call.
yeah. भाई यहाँ पे सभी के घरों में वो राम मंदिर के अक्षत आ गए.
कहाँ पे क्या आ गए?
अम,
ओके, ओके, ओके.
अक्षत है बोलते हैं ना.
No,
हाँ,
sorry, sorry,
हाँ,
sir.
हाँ,
There was a emergency call from the hospital. Uh,
Sir.
Harsha, I want to ask you some question, Ravi bhai.
yes.
Sir, you in your slide you had mentioned that medium to large and large hospital, and then you had also told that corporate hospital, right?
Okay. Yeah. Yes.
Like the categories. Sir, how to identify this medium to large hospital or large hospital or corporate hospital? Like what hospitals are called as corporate hospitals? Like how do we know
Uh,
as a common?
As a common man, yeah, yes, sir. So a small hospital is less than 30 beds. 30 bed hospital is called a small hospital. 30 to 50, 30 to 50 is small to medium. Medium to large is 50. More 50 to 100. More than 100 bed hospitals are large hospitals. All these hospitals managed by MNCs. Okay, they are called corporate hospitals, sir.
Like for example, Manipal. Manipal is a
Yeah,
corporate
Manipal is
hospital.
a corporate hospital, sir. Yeah,
Okay. And SS Persh,
yeah. SS Pers is also a
corporate
corporate.
hospital.
Yeah,
Okay.
yes.
Okay. Yeah. Okay. And second question. So when you said best insurance company, um, like how do we identify that, sir? How to identify best insurance company?
I told you it's a very tricky situation.
Yeah.
Um, uh, the insurance company, when we were in most need, if it approves our insurance, there is nothing like that. Okay,
Correct.
and apart from that, uh, I have 2 points that we have to take care is one is the insurance company which has a good market share, and second is good claim settlement. And apart from that, one thing that as a insurance availer, we should disclose all our problems prior hand. Okay, if there is anything which is hidden, if they come to know insurance company, they are straight away going to reject it. Okay,
Yeah.
and one thing that happened, even one of the patient which needs actual hospitalization, no doubt it's a febrile illness with dehydration, with severe dehydration. Child was came 3 times for the hospital. I was reluctant to admit, but child was very much dehydrated. So I admitted that patient. One of the insurance company has rejected straight away rejected the claim. Okay, so and we have to fight those insurance companies legally. But if it is a small amount, we can pay it and we can get the treatment done. But at that point in time, it is very stressful for all of us.
Yes, sir. So you say it is tricky to select the insurance, or we have to go with the highest market share and highest claim settlement. That would be always the best insurance
That will
company.
be always the best, sir.
Best.
Yeah.
Okay. Okay, sir. Sir, and continuing to that, you said that higher market share, better the control over tariff. Higher the
Correct.
market share, better the
Yeah.
control over tariff, you said. So we as a common man will not know which insurance company has the better control over tariff on the hospitals, right? Is that
Sir,
also equal to high market share and high percentage of settlement?
whenever I mean, as I'm in a hospital, so I know whenever we are going to hospital, so we can ask them we can ask them the tariff list. Okay, so there is a two tariff list will be there. One is the cash when I'm paying a cash, and when I'm in insurance. So there will be definitely there's a definite chart will be there with most of the PROs or with the IP person. So they will explain to us, this is your insurance, this is how, if your claim is registered, you are going to pay this much. Okay, so we will definitely come to know how my experience is nearly 25% difference will be there between the cash and the insurance payment. For example, if the tariff is 10,000 for the cash, there is definitely 7,000 fine for the insurance.
So we should always compare the cash price versus the insurance.
Definitely cash versus the insurance. That's very important, because if our claim will get rejected, we have to insist that the hospital, we are going to pay as per the insurance only. We should tell the hospital that we're going to pay, even if it is because I'm going to go for a reimbursement, they are going to settle me this much amount.
Yeah. Okay, sir. Thank you.
That will save our at least some amount of money and some stress.
Of course. Yes, sir. Yeah. Sir, and
Ravi,
another one.
Hello.
Santosh, sir, 1 minute. I'll continue with one question and then I'll stop. My last question. Sir, you said insurance, when we are taking an insurance, health insurance, you said base plan of 10 lakh and always you need to have a super top up of 50 lakh with 5 lakh deduction. So what do you mean by that deduction of 5 lakh, sir?
What happens is the base policy is going to, if for example, if the hospital bill is 20 lakhs, okay, so my base policy will take care up to 10 lakhs, okay. So the remaining from 10 lakh 1 rupees to remaining whatever amount, like 20 lakhs or 25 lakhs, the super top up is going to take care. Okay, why I told 5 lakhs deduction is, for example, the moment my health insurance is going to exhaust till 5 lakhs or 6 lakhs, I should get technical, we call it as a technical discharge. I should get discharged from that particular center, or we can continue. We can give our additional insurance to the hospital. Okay, you stop insurance claim from that particular. You start billing to that particular insurance. You start billing to my super top up. Okay, so in that sense, I'm going to save my base policy for 4 lakhs rupees, at least 4 or 3 lakhs, whatever it is. So in that sense, 5 lakh deduction with 50 lakhs top up will make a lot of sense compared to 10 lakh deduction.
Okay, sir. Thank you. Thank you so much. Santosh, over to you.
Santosh.
Hear me?
Yeah, please. Yeah, tell me, Santosh.
Yeah. Before looking for an insurance purchase of health insurance, should we look at the diseases which are covered, or all the diseases are covered in the health insurance?
Yeah. So there are so many. So many disease-specific insurances are there. So comprehensive, we call it as this general insurance. We call it general health insurance. We call it comprehensive health insurance. So comprehensive health insurance covers all the diseases. So there is no need to have a separate cancer insurance policy, or a separate heart and lung element insurance policies, separate corona insurance policy. So absolutely there is no necessity to have these separate insurance policies. We can have a comprehensive insurance policies which covers all the diseases.
But many a times we see this marketing like a COVID separate insurance, critical illness separate insurance. Should we opt for it?
Yeah, so specifically when COVID happened, so most of the people have bought the COVID insurance. So some of them got really benefit out of it. So however, there is no, I don't see a reason to have a separate insurance, because even the COVID is also covered under the health insurance, because IRDA immediately Government of India and IRDA immediately came with the guidelines for all the health insurance providers to cover the COVID also. So absolutely no need to cover the go for a separate COVID insurance policy, because the COVID insurance covers somewhere around 180 days or some 270 days, 210 days, something like that, 60 days, one month, something like that. So absolutely there is no point in going for that insurance.
One more question. Suppose we shift the insurance, like suppose I have HDFC Ergo, now I shift to New India Assurance. Will the
Okay.
pre-existing illness again there will be any waiting period or will it be covered?
Whatever the pre-existing diseases that are defined in the HDFC Ergo, there is those will be carried forward. There is no need, there is no waiting period for it. However, if there is any new disease has occurred, for example, I was not diabetic when I was with the HDFC Ergo. If I am become a diabetic now, so I have to disclose that, and that there is a waiting period for that diabetic related issues for the next 2 years or 3 years, depending on insurance provider. That's the reason I told whenever we're opting for a good insurance, son, we should go from the beginning only. We should go for that insurance company.
Thank you.
Sir, continuing to that question, say for example, I mean, just to understand what you said, say first I will have HDFC Argo insurance, and then after insurance I was diabetic, and my diabetic now I have crossed 3 or 4 years with the same insurance company. Now in the 8th year I am going to change the insurance company. Then again my 3 years will continue. Is it?
No, sir, no.
No, is it okay?
No, that will be continued. Actually, even all the pre-existing diseases will be continued.
So while now taking a new insurance, which say now I'm going from HDFC Argo to say ICICI, I need to declare that I'm diabetic in that ICICI when I'm taking that policy, right?
Yes, sir. Definitely, we should disclose that.
Okay. Okay, sir. Got it. Thank you.
When having a health insurance, when to disclose the new illness? Suppose somebody becomes a diabetic hypertensive. So before the next premium, it has to be disclosed, or how exactly it has to be disclosed?
Will it be
And there is,
disclosed, sir?
if we are continuing the same insurance policy, there is no need to disclose that illness at all.
No, I mean, if the patient is admitted with diabetic related illness and it's not disclosed during the time of policy purchase. So after
Yeah.
5 years,
So
patient becomes diabetic and he is admitted with diabetic related illness. So they send
because
a query that it's not really disclosed.
no. So we have to write them back that. So when the patient was bought the policy, he was not diabetic. He came to know diabetes recently. Okay, if this problem happens, this kind of issues happens. For example, many of the customers, they buy with a specific intention. Okay, for example, if they have some gallstones, so they purchase that without disclosing. They purchase the insurance, and after 6 months they go for a surgery and go for a claim. Definitely it is going to this is going to get rejected.
Hello.
There is one query from Shruti. Na? If you have a health insurance for 5 to 6 years and now newly get diagnosed with some illness, do we need to call and inform the insurance company? I think it's answered already. Yeah. Anyone else would like to add or ask anything?
I would like to say that
Yeah,
as
Nitin.
as soon as you get to know a particular disease, you should write a mail to the insurance company stating your insurance policy that this is a newly disease diagnosed for the insurance with this insurance policy. Because if you have a claim in that particular insurance year, then they will this can create some confusion and your claims can be rejected. So as soon as you get to know of a particular disease, cardiac, any disease, just write a simple mail stating the insurance policy number that this particular new disease has been identified. This has helped a lot of people I have seen, because what has happened recently is a claim was rejected because the disease was identified in the same year and not informed.
Amit sir, even if the policy is 5 or 6 years old?
It does not matter how old the policy is. It matters that when was the disease identified. If the disease has been identified, is a fresh identification, you need to inform them with a written mail that this is a new identification, and that has been being informed to the particular insurance provider. On the safer side, this should be done.
Thanks, Amit bhai.
Yeah, I have a question. Hello.
Yes, sir. Yes, sir.
Is there any health insurance provider which provides insurance to a person with congenital heart disease?
No, no. Even corporate insurance, like corporate insurance, because the corporate insurance means the person who is working in a big corporates like TCS or any of the IT companies. So their insurance is more powerful, because what I've seen is their claim is never get rejected. Even in that condition also, any congenital disease for that matter will not be covered. Not only heart diseases, any congenital disease, the moment we write any congenital in the diagnosis, that will be straight away, it is not going to be admitted.
No, but that person, can he not get insurance for other ailments?
Yeah, so except that, for example, sir, what happens is most of the things what I've seen is the rejection rates are so high, So for every disease, for example, if there is any because of the heart disease, if the child is going to develop a kind of a pneumonia or a lower respiratory infection, so they are going to send us a query. I mean, is it related to the underlying heart disease? Okay, because it's very difficult as a clinician. It's very difficult for me to tell whether it is it is not because of the underlying heart disease, because underlying heart disease may play some role in getting that infection. So there is
Right.
definitely a gray area in that. So very difficult to go ahead with that.
Okay. So I asked this because I have a cousin who has a small VSD,
Okay, sir.
and
Okay.
the person is an adult now. So later on in life, he may develop diabetes because of family history. So even in that case, he cannot get any general insurance with
No,
exception of
no,
CHP.
no, sir. No, sir. Okay, VST is a very small thing. Okay. What I
Uh-huh.
mean to say for the congenital heart disease is I mean, very complex
So your voice is not coming through, sir.
by surgery or any interventions. Okay. For these kind of things, definitely they will cover, and we have to disclose. Audio is not connecting. Hello. Can you hear me now?
We
Yeah,
can.
you're audible now.
Yeah, now we are audible.
Yeah.
That person can get an insurance, right? Health insurance.
Video is frozen, sir. Ravi, sir.
Hello.
Hello, sir. Can you hear now?
Yeah.
Yes, sir. Now we can hear you.
Same person can get a
Yeah.
health insurance.
Yes, yes, definitely he can get. We have to disclose that, and it depends on
Uh-huh.
the insurance provider. Okay, so some people will not give the insurance. Some will definitely give an insurance. In the
Any
first place,
ideas of which
we should disclose
company?
that. We can try all the. I mean, like we can try, sir. I'll I'll just get. I'll just find out that also, sir. Okay.
Right, sir. Right, sir. And any company which provides insurance on OPD procedures and imaging in
Sir,
India?
the yeah, I mean the premium that payment is not the worth to avail that service also. Okay, because a lot of terms
Okay.
and conditions. Some of the insurance companies have, but the amount of there is a lot of restrictions. We're going to give this much only, and this will not cover. This will cover. So a lot of these things are the terms and conditions are there.
Okay. All right. Thank you, sir. Thank you.
Sir, can I
Thank
add
you, sir.
two points? Many of the people who go through Policy Bazaar and all these portals, they also push for health insurance with maternity cover, with OPD cover. These are the two add-ons which are better avoided, because what are we going to have? With the maternity cover also, they will have a clause that the second pregnancy or the third will be covered or something, and there'll be a holding period. Like after 2 years, it will be covered, even if it is covered first pregnancy after 2 years. Now, no one is going to
Correct, sir.
plan the pregnancies based on the insurance coverage, and we are going to have maximum 1, 2, or 3 kids, majority. So in that case, we will end up paying a higher premium for rest of the life for just two natural events. This is one thing.
And
And yeah, yeah, Ravi, you're saying something.
And one more thing, sir, to add your point, the amount of coverage is 45,000 rupees. Okay.
Yes, limited
For
cover,
the
limited cover.
including everything like BB cover, everything, 45,000 rupees. 45,000. It's impossible to have a cesarean or normal delivery in India.
So
45,000. That amount is very negligible.
45,000 paying, even if the cost is 1 lakh, or let's say in the best of the hospital 2 lakhs for a cesarean. So two pregnancies, one can definitely afford 4 lakhs. And in that, why should one pay a higher premium for the rest of the whole tenure? One thing. Second thing, what people do is they opt for OPD cover. Now, OPD cover is not going to be more expensive. The expenses will be more when the person is hospitalized. Especially as Dr. Ravi said, hospitalization in the medical or a medical condition where the ICU coverage will be very high, and it can even surpass the surgical treatment bills and all. So, but as he rightly said, hospitalization, it's basically should be a hospitalization cover. And also many of the daycare procedures are also covered, where the admission is less than 24 hours to daycare procedures.
I think dialysis and cancer chemotherapy through chemoport will be considered as OPD procedure. I think that's the way the catch is.
No, sir. No, I have gone through that. Especially for the dialysis. So though it's a OPD procedure, so the dialysis will be covered. Dialysis will be, they are going to reimburse that. Even there is a MOU, like agreement between the hospitals, those who provide the services. So that will be covered, sir. Dialysis.
And cancer chemotherapy through chemoport?
Definitely, it is covered. It is covered.
You don't
Okay,
get
thank
cashless for both of these, but you get a reimbursement for these.
No, Amit bhai, just now I went for my hospital. I went for a agreement. So there also 1,100 per sitting, 1,200 something they are ready to provide cashless.
Okay, Max Bupa is giving both of them, but this is giving on
Reimbursement basis.
reimbursement basis.
Yes.
They are
So
reimbursing the bill. They have not set
some
up the rates.
yes, sir. But you know what? Why Amit bhai, reimbursement is very costly for insurance provider. Okay. So it is so nowadays they are including for all the agreementation. So they are including even the dialysis also, because it works out much economical for them compared to the cash pay.
But 1,200 rupees for one dialysis. That's all.
1,100 to 1,200 rupees, I think. I mean, I don't know exact amount now.
Yeah,
I don't
even
remember.
if it is 1,100 or 200. Now mind, that's I think government rates. GIPSA.
Chips are rates, yeah. And they give us separate money for this. Can we, what do you call it as a
FNB is separate.
artery? This cannula.
Yeah, catheter. They give
Catheter
around
and other things
350
will give
rupees for that.
separate. They'll give, and even this the anastomosis. What do you call it, sir? I forgot.
They have fistulas.
For
AV
fistulas,
fistulas.
AV fistula. Thank you. They'll use separate money for that, sir.
Okay, GIPSA is giving for chemoport.
What also is doing, sir?
Okay.
I have shared a policy. If can you please go through it once? It is basically
Yeah,
for my
one second.
father who will be relocating back to India, and this is the
Okay.
proposed one.
How
Can
old
you
is
please see? He's 72.
how old? 72, sir. Okay.
Yeah.
72. Yeah, very few insurance providers will give insurance policies above.
I have shared the insurance in the messages. It's given by Max Bupa. It includes my mother as well. So it's a family kind of insurance.
Insurance. Sir. Okay, okay, sir. Okay, sir.
Thank you. Thank you.
What is the payment daily? No copay for any age. If there is no copay, so then it's good, sir. All daycare procedure covered. 5,000 for looks good, sir. Because Star provides above 60, but there is a 20% co-payment. Is there?
Also check Silver Health Plan from Bajaj Alliance. This Silver
Okay.
Health is only for senior citizens.
Senior citizen, yeah.
And there is one more care freedom
Thank you.
plan. Care freedom plan for senior citizens with a rider to waive off the co-payment for senior citizens.
I mean, my personal experience with the care is very bad.
Yeah, yeah,
Because,
bad. But when people have understood the insurance late, what other option without co-payment?
now currently, Nimabupa is settling the not only the settling amount, they're paying even they have a coverage for even these consumables also, sir. So they have one rider where the premium is just a 500 rupees more. So they cover the consumables also. So as of now, they are aggressive in increasing their market share. Probably they are giving a good coverage. I don't know what happens when we are too old.
Max
Which
Bupa, na?
Max Bupa?
Max Bupa, yeah.
Max Bupa.
Yeah, they are giving
And now it
even
is
Care
airport.
shield, care shield, care shield. The shield,
care.
shield,
Name is
Shield.
changed.
shield.
Yeah. Nimabupa
They
it
are
is
also
now.
giving air taxi for
Super.
air ambulance.
Air ambulance. Okay.
Air
Ravi bhai, who should have insurance? When should one have insurance? And if a person says, I have a net worth of 20 crores, 200 crores, should they also have insurance?
It depends by how they approach it. But my feeling is, when there is an insurance is there, so when we are eligible to get insurance, better to have a health insurance. I feel. So far as term insurance is concerned, it doesn't matter. But health insurance, I think it is required in the current era. That to adequate, not small amount.
And Ravi bhai, do NRI need health insurance in India as well?
Sir, I think if you are traveling frequently, recently I had one baby. They are from Germany. The child got ill and it admitted in ICU directly, and the bill came to 2 lakhs rupees, something like that, to 2.5 lakhs rupees. So, I mean, they are frequent. If you are frequent visitor, I think Deepak bhai can answer this better than me.
Can I add Ravi by something? See, NRIs have a misconception. Now, majority of the NRIs are outside India for one major reason of employment. Now, the health insurance provided by the employer will only last till the scope of employment. So, if they are
Okay.
no longer employed, the coverage is gone, and one is without a cover. And majority of the NRIs tend to return back to India at one point or the other point. Now, during this tenure, if they develop any disease, when they come back to India, they may have many of the lifestyle diseases, diabetes, hypertension, nephropathies, and other things. At that time, if they honestly declare the ailments, there are three possibilities. The insurance company may give the insurance or make not give the insurance. Second possibility, or third possibility is with a increased payment, that is increased premium amount. So why subject ourselves to those? Now, it is a very tiny amount which we pay for our protection, because majority of us will tend to go back to India at one point or the other. So it is better to have a health insurance back in home country, and it is very cheap. If you compare it with anyone who is earning outside, if you compare it with INR, it is quite cheap. Let's say if yeah, definitely.
One more point I want to make here is, uh, if you know a good agent who provides a health insurance, it's better to go through that agent. Okay, I mean, this is my personal experience, and not only that, I've seen in many hospital also. If they are good network agents, the premium will be just 1,000 rupees higher. Okay, compared to the direct purchase and the agent, through agent. So the agent call will make most of the times to settle the claim, to admit the claim and settle, good give a approval, claim approval also.
Sir, for
And
NR,
what
can I ask the question, sir? Hello.
Yes, sir.
one more
Sir,
Hello.
Varun sir, can you please mute yourself? Varun sir.
Yeah. Oh,
Yeah, Dr. Anmol, I think you can ask your question. And then maybe Dr. Prashant or Prashant sir can ask.
Anmol sir, you can go ahead, sir.
Anmol sir, can you hear us?
No, just I wanted to know regarding the health insurance for parents and pre-existing conditions. No, any insurance covering those things. In between, I got logged off. If that point is covered already.
Sir, for pre-existing diseases, people, I mean, many insurance covers, especially diabetes and hypertension, because it's very common nowadays in India. So most of the insurance companies will provide. So two things there. One is there is an extra premium for it. Okay, this is called, I forgot the name. This government insurance provider will put that additional for 1,000, 2,000 rupees additional.
Loading charges.
Loading, loading, correct. Loading. And second thing is that we can avail this. I mean, we have a waiting period of 2 years or 3 years. Okay, and Max Bupa has come up with a one thing. If we pay a little extra, or if we cover that for 3 years, so that loading also will be they are going to waive off, and the disease will be covered from the day one. So this happened with my parents. I was porting from one company to Nemo Bupa, because the other company was not providing me the increase in the sum insurance because of the age factor. So because my mother was entering into 60th year, so I wanted to have a minimum of 10 lakhs for her. So what I did is I went to Nemo Bupa. By that time she had a little thyroid issue something. So I disclosed that, and they took it for 3 years. 3 years, and both disclosure has I mean, the disease is covered, but and even the waive off is also done because I purchased for 3 years.
Any specific company you suggest, sir, with your experience? Like, because I earlier I had one experience for my.
Murali sir, Mike.
Hello.
Hello, sir. Yeah, I'm hearing. Yeah.
Because you must be knowing, in between one Bank of Maharashtra was in association with one of the health insurance company. They used to give pre-existing condition health insurance. So we used to cover our parents under that insurance, like my father-in-law, because he was not employed somewhere. And after his retirement
Okay,
and all,
sir.
like I had taken that insurance company, and suddenly last year that company is saying the premium will be around 75,000 per year. Earlier it was given around 34,000 with the declaration of pre-existing conditions. 75,000 sudden rise. I was a bit surprised. So because of that,
Yes,
I was
sir.
just
Yeah.
asking.
Yes, sir, definitely. I wanted to have enlighten. I mean, I'm following. I'm telling you. I'm making a SIP of 1,000 rupees per person uh, in my family. For example, if we are four, I'm making a 4,000 rupees SIP separately towards this increase in the premium, because they have to increase the premium. So there is no other way that they can provide the health coverage without the increasing the adequate premium. So I made a one SIP of 4,000 rupees per month, just to just to accumulate the corpus to pay for the future premiums. Not now. Now it is around 35,000 that I can afford. I think that is definitely going to increase by at least 15% per annum, sir. 10 to 15%, because that is what the inflation of the medical is. They have to increase that, sir.
Yes, sir. Thank you so much.
And better to don't discontinue, sir. I have just now my friend mother, so she had a massive intracranial hemorrhage, and 1 month back only, he is an employer. He was my friend's father-in-law was an employee of Syndicate Bank. He was supposed to pay some 5,000 rupees for just a coverage of two for himself and wife. So 5,000 rupees he forgot, or I don't know what is. 1 month later, this catastrophe happened. They end up paying 15, some more than 10 lakh rupees for this intracranial hemorrhage post hypertensive.
Yeah, I do understand your concern, sir. But at the same time, I was thinking, instead of paying premium, then why not do SIP for health coverage itself, that hospitalization coverage itself, monthly SIP? That was my thought process.
Yeah, in that sense, I'll suggest you one more thing, sir. Okay, yeah, at least you buy a super top up. Super top up is way cheaper than the this one base policy. But nowadays, without base policy, people are not giving a super top up, it seems. I have to verify that. One thing what we can do is we can have a super top up. For example, 5 lakhs. We can accumulate 5 lakhs rupees. Super top up can be bought, actually. That can be done.
Okay, sir. Thank you so much. Thank you.
Sir, other answer to your question is, if we make a SIP for health and not opt for health insurance, now we are not sure that the same disease may not come knocking in, or another new disease may not come in. So how much allocation we have for this health or medical treatment, it will compromise our other goals. So we are going to pay a very small price for a higher coverage the rest of the life, because all these health insurances have a lifetime coverage. As long as you are paying, you will be covered. So starting right from the birth, please tell me. Right from the birth till we die, we will be getting a coverage for a amount which we are paying. Now, in some of the situations, the claim may not get honored, even the genuine claim. We can definitely fight it out for reimbursement. If that is also not there, IID and all are there. If that is also not there, then the corpus set aside for emergencies can come into handy. But not having an insurance, and we think that we make SIPs, and that would definitely compromise the other goal, and the other goal is retirement. Apart from medical surgical expenses, we would have to maintain our lifestyle. We would have to have child education, their marriages, other expenses of household that will be continuing indefinitely. So doing so and accumulating a larger corpus for medical and surgical treatment would definitely compromise other goals.
Yes, sir. I do understand. Thank you so much.
Yes. I recommend SIP for premium. Hello.
Ravi bhai, you are not audible.
Some issues there with my network. I think I'll just connect with my mobile.
Yeah, you're audible now. You're audible.
Yes, yes, sir. Hello.
Sir,
Yes,
can
sir.
I
Now
ask a question?
we can hear you, sir. Ravi, sir.
Yes, sir. Yes, sir. Rao sir, please go ahead, sir.
Sir, I have a question regarding this base policy and super top up. How it works actually in real hospitalization? Like how to monitor this when the hospital makes billing? How much percentage of base policy they will be charging, and what percentage of super top up will be charged?
They will not do it, sir. We have to tell them, sir. Okay, for example, say I have a base policy of 10 lakhs rupees. So the moment 10 lakhs moment 5 lakhs get exhausted, I have to inform my insurer to send a claim. We call it as a proposal to the insurance that this person is admitted in the hospital. So kindly, this amount of bill has happened, and we are getting it from insurance A, and the rest of the money we are going to charge to you. So that's how they'll send a communication to the insurance B, which is a super top up.
This will be happening while hospitalization already is being happened.
So that is done by the hospital. Or else we can go for a reimbursement. The policy B will
my
monitor the
question
bill
is,
also, sir, continuously. Yeah, daily billing.
we have to monitor billing on daily basis in that case, and then meanwhile you have to be in touch with the policy provider.
Sir, as I know, every day hospital will update the bill and take a signature, sir. Most of the hospitals.
Okay.
Every day. Okay, this is what we follow, and most of the hospital also does it.
Okay,
because,
we have
they
to
should
tell
having aware of how much. In the prior hand also we can inform the hospital also. So okay, still 5 lakhs. You take it from my this son. The moment it crosses 5 lakhs, please let us know. That also we can put a word to them.
So in other words, when the base policy totally exhausts, then the super top up will not be of no use in that case.
Hello, sir. There is some network issues there. I'll connect. Hello, sir. Can you hear me?
I can hear you, sir. Now.
Base policy exhausted?
My question is, if my base policy is for 10 lakhs, and when real hospitalization happens, I did not notice the bill, and maybe I got discharged after like 15 lakh bill has arrived, and I got discharged, and the policy, the insurance provider, he has gone ahead and settled the 12 lakhs settlement, covering 10 lakhs as base policy and 2 lakhs as super top up.
No, not necessarily, sir. This is our prerogative as we have a right to tell the this one. So take up 5 lakhs and 5 lakhs to the send a bill of 5 lakhs to the insurance A. Or what we can do is we'll do something called as a technical discharge also. Okay. So after 5 lakhs, we do a technical discharge and send the bill to the insurance A, which is my base policy, and we can readmit again, and we can tag it to insurance B, sir.
So Ravi sir, sorry to interrupt. I think the question from Rao sir is that if we do not notice and if they claim the entire base policy and the additional amount over the base policy, whatever is left over, if that is claimed from the super top-up policy, after this incidents, will the super top-up policy will be useful or no more useful?
Sir,
am I right,
useful, sir?
Yeah, that's correct.
It is useful. It is useful. Okay. So there is a two policies so far as this additional coverage is concerned. One is called a top up, another is called a super top up. So in top up policy, the only one settlement will happen. For example, I got admitted. It's a 15 lakhs bill. The base policy will cover till 10 lakh. The top up policy will cover 5 lakhs, 15 lakhs. That's the end of my this one. Okay. Whereas in super top up, we can claim n number of times. That's the difference between top up and super top up.
Yeah. Okay, so even if the base policy is exhausted, we can still have that claim from super top up.
Yes, sir. Yes, sir. We can get a coverage.
Okay. So related to the same topic, is there any requirement of a certain percentage to be claimed from the base policy, and then rest of the claim should be claimed from the super top up? Like out of 10 lakhs, At least minimum 50%, 25% if we have to use, and then only we have to go for super top up, or there's nothing like that.
No, sir. To claim the super top up policy. Okay, so we have to, like, for example, my super top up policy is 50 lakhs and deduction is 5 lakhs. My bill should be minimum 6 lakhs, sir. Okay. So then only they'll give 1 lakh to me. They will give 1 lakh to me.
Okay.
Otherwise, they will not give 1 rupee also.
So if my base policy, so if my base policy is 10 lakhs, and if my claim is only 6 lakhs, then I do not use
super top up. Yeah.
Oh, okay. Only when the sum, I mean, when the claim goes beyond the base policy, then only super top up will be utilized.
Super top up will happen. So that's the reason I told you something called as a technical discharge. Okay. What we do, for example, if I work in a corporate also, in a corporate, both mother and father will be working. Okay. So father will be having coverage of 4 lakhs rupees. And mother is also having a 4 lakh rupees. So we'll go ahead with the father insurance first, because mother insurance should have been utilized for her delivery. So what we do is we admitted our baby under the father's insurance. So the moment the 4 lakh crosses, we are going to do a technical discharge. Technical means we send a technical discharge bill, everything to the insurance, and we readmit the patient. Patient will be there in the hospital only. We'll do a readmission. Okay. We readmit under the mother's policy. Okay. So that can also be utilized here. We can do a technical discharge and send the insurance payment to our insurance A, which is a base policy, and we can send the additional, we can readmit the particular patient under the policy B, which is a super top up.
Okay. I think if the hospital or insurance company does not provide these options to the patients, as a layman, I don't think we may be able to think of these options. And yeah.
Sir, usually we should, if we discuss with the, we are hospital provider. We train our insurance people, insurance person who handles inpatient. We tell them this is the option, this is the option, these are the options. Okay. So once they do know, sir, they'll for the next patient also they'll do it without any problem.
Yeah.
The most important thing is, while we buy insurance, if we read the prospectus detailed, even the fine prints, it needs some time before buying the insurance. If we read word to word, we will understand the basic concept of base insurance and super top up. And when we are aware of it, the hospital people and the insurance guy, the cashless claim department sitting in the hospital, can definitely guide the patients and their relatives when the need arises. The first thing is, we need to be aware what our insurance is, what is it covering, and what is.
Hello. Yes, sir. Now we can hear you.
So we know the right and we can fight it out in that case.
I agree. Agree. Sir, can I have one more question?
Yes, sir, please.
So it's regarding, in general, based on your experiences, I'm hearing that Max Bupa is coming up with a lot of flexible options to meet the customer demands or customer needs.
Not customer needs, to acquire the market share, sir.
To acquire the market share. But based on your experience, and maybe Amit Bhai also can comment, are there any, if we have to list down like recommendations, these are 1, 2, 3, 4, these are the better ones. If we are not able to get any policy suitable for our requirements from these top 3 or 4, then only we should look for other companies. Is there any such recommendation, sir?
Sir, yes, Niva Bupa currently it's giving good claim settlement, but my concern is when we enter into age of say 55, 56 with a pre-existing disease, that's where real problem happens, I feel. Okay, so that's the reason. That's the reason. Though it's giving, say, out of 100, it's giving 90 rupees. We may look at that lucrative thing, but I still consider the old old policies only. Government policies are, I feel, much better with the control of GIPSA. Okay, so that is my opinion. And one more thing is, this New India Assurance will allow you to buy online if there are no pre-existing disease, even at 59 years, sir. 59 years. Okay.
Okay.
So that I recently bought for my mother-in-law. Fortunately, she was not having any issues. Okay, so I bought it for my mother-in-law at 59, just 3 months before her 60th birthday.
Okay. So
Yeah,
I
can I
have
ask
one
a question,
HDFC.
please?
I mean, earlier it was Apollo Munich. It got
Yes,
merged
sir.
into HDFC. So
Yes,
I'm
sir.
just continuing it from past more than 15 years now. So I'm
Okay,
just,
sir. Okay.
I mean, exploring whether is it good to port to some other better one,
Yes,
or
sir.
do we continue with HDFC? I just want.
No, HDFC coverage is good with the small hospital also, sir. And even big hospital, it has a good coverage. And they are, I mean, for the hospital also, they are providing a good tariffs. The company which is providing a good tariff to the hospital, so that means they have they are in the business. They are
Right,
doing the
right.
relief.
Yeah. Okay. Good to know that. Thanks, sir.
Sir.
Sorry, somebody else were asking the question. Sorry, go ahead.
Can I ask a question, please?
Yes, sir. Please, sir. Please, sir.
Yeah, see, I am an NRI and an insurance coverage is provided by my employer to me, right? And there is no pre-existing conditions which are defined or notified to the insurance company. In such case, if I have to go for an insurance back home in India, do I have
Okay, sir.
to inform them of my pre-existing conditions, and do I have a waiting period?
Sir, definitely we should inform our. I mean, if because it's two different insurances, sir. Okay, so well, most of the employer insurance, especially in India, they are not portable. For example, if I leave the organization, my insurance will lapse there only. Okay, so I do not have a control over that insurance because that there is a MOU or understanding between the company and the insurance provider. Okay, the moment I leave, there is no control over it. So I have to. This is a fresh policy only, sir. It's a new policy, even if I have a other policy.
No, if I do it while I'm still at the employment, right, before
Yes,
leaving the
sir.
employment, then also I have a waiting period and I have to re-inform them of my existing conditions.
This is the right time for you to do the insurance, sir, because you still have a coverage with at least your employer. Okay, so that even if they put a 3 years or a 4 years coverage, okay, 4 years waiting period, it is the right time for you to enter. Okay, so you may continue in your job for another 3 years or 4 years, so that by that time your Indian policy will be good enough to use for your existing pre-existing diseases also. This is the right time. And for when I discussed with Deepak Bhai, he was mentioning that even if our employer are providing insurance, it is always very essential for us to have our own insurance policy, because we don't know when our employment will get over, or there may be a reduction in the coverage, because there is a budget for all the companies to provide for the employees benefits. So they may reduce the budget, so hence the coverage may be reduced. So many things will be permutation combination will happen. It is better to have our own insurance coverage.
Thank you, sir. Thank you.
Thank you, sir.
Other advantage for NRIs is, let's say NRIs continue to stay in a overseas country even after employment and all. Some few people stick on to it. If they have a health insurance back in India, which is very economical, and we know that rupee has been depreciating. So basically, every year, even if the insurance premium increases every 5 years, like insurance for person with 31 to 35 years of age will be something, and 36 to 40 will be, it will increase. 41 to 45 will increase. So they increase the premium every 5 years. But even then, one would be giving less premium. Now, if they continue staying overseas, if they have a health insurance, they can anytime fly back to India, get a treatment done. Just like how UK people who cannot wait for that NIH schemes and all, they travel for medical tourism to India. Here you can travel for non-emergency. I'm not speaking about emergency. For non-emergency conditions, ailments, and get the treatment in the network hospitals or non-network hospitals and claim for reimbursement. So for NRS, it is very, very beneficial to have insurance. NRS is just a tax status. We are still Indian citizens. We do not know what happens in future. Majority, as we discussed, will definitely go back to India. That will be the retirement place. So it is better to get the insurance when we are in good health, when we have no pre-existing illness to declare. And when we come back to India, if we have a pre-existing illness, companies may or may not provide. Even if they provide, it will be with a huge premium loading that may be quite high again.
Varun sir, yeah, please you can ask, sir.
Yeah. Hello, sir. Thank you, sir. Sir, I wanted to know if for NRIs, if there are any senior citizen dependents, are there any good affordable insurance policies that we can go for?
Just now, I think this Neo Bupa is providing without any co-payment, sir. Okay. And I know Star, which does provide, but it has a 20% co-payment, sir.
This is in UAE, sir.
No, sir. I mean, you want UAE health insurance?
Yes, sir. If someone is visiting,
sorry.
Are your parents based in India or in UAE now?
So they are in India, but in case if they are planning to come here,
see, sir, when they are in India, they are residing in India. We need insurances for emergencies. Even if they have a health insurance here, you cannot be flying them here for treatment, right, sir? It is better.
Sir. But if they are coming here and if some emergency happens, then without insurance,
if the emergency, in that case, you'll have to, when they are coming on visit, let's say 3 months or 6 months visit visa here, visit visa. At that time, you can opt for local insurance in that period, time period. That's it. Because the Indian insurance will not cover overseas.
Yeah, so we have to opt for local insurance only at the time of visit.
Yes. And pre-existing illness will not be covered in.
Sorry, sir, I did not get that, sir. Hello. Hello.
Can you hear?
Yes. Yeah, Ravi bhai. Yeah. Tell this.
Sir, you can go for a travel insurance. For example, New India Insurance, New India Assurance, and so many insurance providers will give a travel insurance where it will cover the health need also and other travel related issues also. Okay, so that is whenever we were flying out of India, it is must before even at the time of booking of tickets only. We should ensure the insurance from this day to this date. Okay, and ideally one day later, for example, even if we land, say for example we land in 14th of January, we should have a coverage till 15th of January overseas. Okay, so the same thing happened with one of the I think one of person whose mother went for a Singapore or Hong Kong trip. So there she had a massive MI, and the amount of bill was very exuberant. Okay.
Does the travel insurance cover pre-existing conditions, sir?
That I'll look into it, sir. I mean, we have to declare that. I think we have to look into it, sir.
Okay.
Travel insurance, Indian travel is very quite affordable, and irrespective of people, if anyone is stepping out of India for whether for tourism purpose or for visiting their children back in any of the countries where they are NRS, they should take travel insurance. Or the benefit of having a local UAE insurance is that it will be network, cashless. It will be cashless. Many of the travel insurance would be reimbursement, or if they have a network, you'll have to communicate this with the people, the insurance team in India. They will negotiate with this hospital. That may take time, and many of the claims may be reimbursement basis. Pay now, claim later. So if they are coming to kids, visiting kids, Daman insurance and all are very much affordable, and it will provide cashless there. Pre-existing illness will not be covered. None of the insurances will cover pre-existing local. Even the travel insurance, majority they will not cover it. If you look at the wordings, pure emergencies, then even repatriation of mortal remains, many other things are covered. Even if you have some riders, even the passport, medical assistance, all many more things will be covered. Documentation charges and all, they will be covered. Even the litigation charge. If supposingly someone is visiting a foreign country, he or she is arrested with some litigation for some reason XYZ, they would even cover that. So it is always in our interest, when we are buying such a costly flight ticket, a fraction of it can definitely be dedicated in having a travel insurance.
Okay, sir. Okay, sir. Thank you, sir.
We have any more questions? Ravi bhai, you are around?
Hello.
Yeah, Ravi
I'm
bhai.
here, bhai.
Yeah. Do you have any more
The thing
questions?
is, one more. Some of the
Yeah,
questions. What are the downsides of porting a insurance from one company to other company? So the downside is there are specific time period for porting. Actually, the porting can be done only from, for example, if my policy is getting exhausted on 14th of February, I can do porting from 14th of January only. 14th of January till 14th of February, I have a chance. So in that process, that time period is very, very important. Okay. So say, because if we, for example, if I approach the company, say on 7th of February, when my policy is getting exhausted on, coming for a renewal on 14th of February. So in 7 days, it's very difficult to do a porting. Okay. So the porting, we have to time the porting very well. We should start because that will only allow 1 month prior. And so that's the one thing. Second thing is we have to disclose the pre-existing diseases. Okay. So that is a very, very important thing. And there may be a premium for the pre-existing diseases. If there are any new non-disclosed pre-existing diseases in the previous policy, so there will be some premium for that.
Sir, continuing with this one question, like how to port, sir? Like, should we go online and then there is an option called as porting?
No. When I did a porting physically only, I just went to the insurance company, filled the form, and I given the previous form. Okay, so they return to they will write a mail to the previous health insurance company just to ensure that there are no claims or anything. So then they'll do a internal work and port it. Private insurance will port very quickly. The problem is with the government insurance companies. Okay, so they'll take some time to port it.
Reply. Okay, sir. Okay, thank you, sir.
So this happened me because my one of the hospital which was covering my parents, but because of their business problems, they said, okay, we can't renew your father insurance. But we have already spoken to the insurance provider. So you can, if you want to pay, you can directly pay from your pocket to this one, and we'll make some changes. So that time it was on some national insurance. I ported it to United Insurance. So this happened smoothly. And the good thing is they did not go for a medical checkup.
Okay.
Because it was policy was there for almost 7-8 years. So the officer over there, he had a power to overwrite it.
Okay.
Ported it.
Thank you, sir.
Hi, sir. My name is Mohan. I'm an NRI based out of UAE. My parents are senior citizens and they are residing in Andhra Pradesh. So if I have to take a health insurance from them, I actually recently came across this Care Freedom Plan. Do we need to ask them to do the medical test, sir? Like for the term insurance we do like that. Do we need to ask them to do medical tests?
That is a very, very important thing, sir. Okay. If we can request them for a medical test also. Okay. because once their documents are clear, because not only buying insurance is important. I mean, when we are in really need, how this insurance company is going to reimburse that amount or admit our claim, that is more important for us. So we have to go for a medical test. We have to insist them for it at least. Okay, you can write to them mail also. Okay, we are ready to take a medical test.
Okay, sir. Regarding this care plan, sir, there is a co-payment of 20%. Like someone was saying, like we can avoid that co-payment also. So, what is that procedure, sir? How to do that?
Only thing is, I think the premium will be able to pay extra premium. Okay, so for in that sense, you can consider this new Bupa, sir. There is no co-payment.
Bupa. Okay, fine, sir. Yeah. Thank you.
And government insurance will not provide beyond 60, sir. Entry age is strictly restricted to 60 years.
Sir, one question on the porting front. If you are in the process of porting your insurance, which insurance company will give you a claim settlement? The previous one or the one you're porting to?
Porting is allowed within the time period of the previous insurance providers. Okay, so if that insurance provider, for example, 14. Hello, sir.
Yes, I can hear you.
Yes, sir. So, I mean, the new insurance policy only comes after the end of the, for example, 14th. Today is the 14th. So my porting should happen before 14th, or else the porting, the other porting, the new insurance company will not provide me any insurance coverage, or they will not take premium also. Okay. So in that sense, I should finish the porting before 14th.
Right, and
even
if
if I finish the porting by 14th, okay, new insurance will happen from 15th onwards.
I think I lost you on the ending part. So my second part to the question was like if you are still hospitalized post the previous insurance time frame. So
Okay,
how
sir.
does this claim happen? So who bears, because
Sir,
you're still continuing the treatment?
So far as porting is concerned, I have approached porting for 2 to 3 times. I did it for my sisters also and my my parents. If there is any previous claim also, they will not do a porting. Forget about admission, sir.
Oh, okay. All right.
They will not do port only because they want to play safe at least.
All right. Thank you, sir.
Hey, hello, sir. Harshal here. Just have a quick question. So I have my parents are around 62 years of age, and I have a policy from United India Assurance, but that has a cap on the room rent for 1% of sum assured, so which is just 3,000. So at what age does it make sense to go for a porting, or it
Sir,
would be?
usually above 60 years, so far as my knowledge is concerned, they won't provide any porting. Okay, one thing. And if there is no claim, okay, United India will enhance the premium. I mean, enhance the coverage also, sir. If there is no this one. In that sense, we can go for a private insurance, sir. That's all. Porting is allowed or not, I don't know actually. I have to look into it, sir.
Okay.
3,000 is very less, sir, actually.
Correct. It is. So I did realize it during the COVID time. I came across this, and 3,000 is very less. So that is what worries me at times.
One more thing, sir. When you go for renewal, there is an option called as a proportionate deduction clause, waiver of proportionate deduction. Okay, so there they charge some 2,000, 3,000 rupees extra premium. So you can ask them, sir. I mean, ask them to go for when renewal happens. That time only it can happen. They can go to the nearest United Insurance. This one, they can ask there. If there is that rider is there, that is very good, actually.
Can you just repeat that once? What's it? Proportionate deduction.
Proportionate deduction.
Okay.
Proportionate deduction means, for example, so your parents are having 3,000 rupees room, coverage for room rent. Okay, if they opt for a 6,000 rupees, sir, 6,000 rupees room. Okay, if the total bill becomes a 1 lakh rupees, so you have to compulsorily pay the 50% co-payment. Okay, you fully opt for that co-payment, proportionate deduction waiver. So then, till the coverage of the, for example, there is a 3 lakh coverage is there. Till the 3 lakh coverage, there won't be any co-payment.
Okay, got it.
We can ask for that, sir. Government insurance providers are providing now currently.
Okay, I'll check with that next time it comes for renewal. I think it will come in September.
What my suggestion is, sir, what my experience with that I'm telling, don't, if at all don't port it. If at all you want, you buy a new one. I know the premium may be a little high, but the control of United India Insurance over the hospitals is very good. Okay, so I think specifically for surgery, okay, surgeries are very easy to treat compared to medical illness, in my experience. So surgery, for example, 2 days, 3 days surgery, you can go for a general ward only. Okay. So the package will be very less with the general ward.
Okay.
Sharing, at least 3 sharing or 4 sharing. And in a big hospital, most of the hospital sharing is also good, sir, actually. Sharing means the cleanliness, everything will be there. There is a partition will be there. I think we can go for it.
Yeah, something like twin bedroom or 3 bedrooms, sort of 2-3
yes,
people.
Correct, exactly. Yeah.
Got it. Thank you, sir. Thanks for the insight. So just one more thing. So I am yet to take a personal health insurance. I have a coverage from my office. So any particular, I'm around 30, just completed 35 years. Any 2 or 3 insurers that I should go with?
Anyway, if you are already covered, you can go for a New India. There is a one policy called as a new age. Young couple or new age. Young couple digital India policy is there, sir. Okay, there is no room rent capping also for that. Okay, and the premium is very competitive. New India.
New India.
Okay. There is no room rent capping. Yeah, you can look into it, sir.
And sir, does it make a difference if I go online or go via an agent? Like, does it make any difference? Like, what should be the ideal way?
If we have a well-known agent who is a well-connected, for example, he is good in the business, so that means better to go with him. Because I've seen in my hospital, the moment there is any problem with the claim, the insurance, this patient will call the agent. Agent will somehow get this done. Okay, this is what I've seen in my eyes. Because straight away they say rejected from the call center. They'll call to their respective agents. They'll fight it out, and at least someone is there to talk on your behalf. This is where one insurance where I'll really recommend an agent compared to a direct buying from the portal. We may save 1,000 or 1,500 rupees max, or maximum 2,000 rupees if you go through the agent, if you go directly. But this will definitely help us. The same thing happened with my son. Usually circumcision they don't approve, sir. Star, I still am at the star. So my agent ensured that all the amount is claimed, and I got a claim also 25,000.
Okay. Thank you so much, sir.
We have any more questions?
Sir, just one general question. Sir, these agents you're recommending or you're referring to, I mean, because I have not come across, how do we get them? Are they affiliated to any of these companies, or they're just freelancers recommending, sir? How does it work?
Freelancer, for example, any of your relatives have got it done, something like that, you can ask them to get it done, or your friends. So you can ask them. But it's not my recommendation, but this is what is my experience.
referring to that, yeah.
Yeah.
Okay, we have to check freelancers. Okay.
Sir, Prasanna sir.
Yeah.
The agents, like how they become agents means there is some exam which they have to pass. Like if they want to become an agent of New India Insurance, they have to go through that one certification or one exam is there under the New India Insurance. That's when they get the that agent code. Otherwise, they will not be able to.
There are two ways to get it. No? One is by that exam that you mentioned, one thing, IID recommend, and then get affiliated to one insurance company, or there is something known as POS, point of sale person, POSP. So POSPs are, again, you go through online test and you get affiliated, you get a certification. That is 15 hours of study and all, and you get certification. And then you have a collaboration with one portal, no? Like Policy Bazaar, you get affiliated with that, or you get affiliated with Digit. And then as a POSP person, you can only offer insurance where the coverage is up to 5 lakhs. That's it. And the person who has cleared this IID exams and are affiliated, then they can provide you the full range of products there. And a person who is really good, who has in-depth knowledge of how insurance works, they will definitely be helpful when the crisis comes, as Dr. Ravi said, because you have some other person to fight for you.
And even when the claim gets rejected or approved, we don't know the terminology or we don't know how to speak to them. See, that is another problem, sir. Insurance. I mean, so that is where the agents, I think, will help, or they will be able to speak on
Other
our
problem
behalf.
is our own laziness also.
Yes, sir. Yeah, that is also there.
Everyone is educated. We know how to read WhatsApp, Facebook, and all, but we should also have something into this.
Yeah. Hope Prasanna, sir, that will help you.
Yeah, of course, sir.
Yeah.
And if anything happens, Dr. Ravi is there. He'll help us all.
Yeah.
Of course,
Anytime you can call.
He's
No problem. Whatever I
for us.
Yeah, because I have seen a lot of agents for life insurance. I have not come across agents for health insurance. That's where
why you know, sir? Why you know? Because they get only 1,000 or 1,500 rupees.
Okay.
100 calls. Okay.
Okay.
That's the reason I'm recommending here, sir.
Yeah. No, I got it.
To add to that, recently I had this insurance from Policy Bazaar. Actually, they shared me my local area agent of Policy Bazaar and also the insurance provider itself, Niwabupa. They shared the contact person's name in my local area, both Policy Bazaar and Niwabupa. So they'll share the local area agent numbers also.
Oh, that's good.
So they will assist.
Okay, sir, definitely. So that's the reason they'll get hardly 1,000 or 1,500 rupees because this is because the agent that I'm dealing with is a friend. He's a school friend of my senior. Okay, my colleague. So he's just done some degree and he's into this. He openly tells me everything. Sir, I'll get 1,000 rupees, but I get 1,000 calls to 1,000 calls.
I do understand that. Yeah.
The
pain is more, gain is less.
Yes.
I understand.
And many of them, they will be opting for insurance where the coverage is less than 5 lakhs. And any insurance which has a coverage of less than 5 lakhs will definitely have co-payment for sure. There are no riders. Riders will be only when 5 lakhs and above. And at that time, they will have co-payment and they will be calling that guy that, why did I get paid? You promised me this, you promised me that. So lack of understanding is also there.
Yeah,
they pay a tiny premium and they want a 5-star hotel type benefit there.
Agree. And people does not have patience to read the entire policy document.
Yeah, they will be reading the porn literature, but no time for this.
True.
That runs into pages, to be very frank, and half of this one we will not understand. We have to sign that or we have to agree to it. That's all.
That is also a point, actually. I mean, the kind of language what they use, is not a very
We need to
common
learn.
language.
We need to learn law, sir, to understand that one.
No, we need to spend a good time, good quality time to understand all of those statements. But it is pain. Sorry, sir, you're saying something.
Deepak bhai, you should now encourage everybody to do SIP for paying premiums. Not now, maybe just 5
Future
years.
premium.
Future premium. 1,000 rupees per person is very, very essential. I think till 45 years, 1,500 for 45 to 50, 2,000 rupees for 50 to 55, 2,500 for above 45, 55, and 3,000 rupees per month for above 60. I think this has to be done, I think, because the premiums are...
Sir, this I'm already doing. I'm also doing for car insurance.
Very good. That's a good thing.
See, because car insurance was suddenly the 20,000, 25,000 comes in 1 month. I mean, which we would have not planned. So I'm actually doing SIP for all these one-time annual charges.
No, that should really be there. Actually, these are very good. Yeah, that is goal-based investment. Actually,
yeah.
Essence of goal-based investment. That is really good thing where we are not bothered about returns. Where we want the right amount at the right time for the things which we need it on a recurring basis. Actually,
So that should become our expenses, I think. Okay.
Yes.
We should divide monthly expenses. Okay, we should, for example, there is a 30,000 rupees premium is going to come. I should divide that divided by 12. So that becomes my expenses, monthly expenses. So that I'll be aware of my cash flows. So that should be done, I think.
Ravi bhai float this idea in the group, na? SIP for this. Yeah, it's really good.
Everybody listens to me.
No, I think this is a good idea by SIP for future premiums.
Yes.
Something many people have not thought. At least I have not thought it. So this is a good idea actually.
You tag it and you keep it, it will not appear costly also.
Definitely, sir.
For insurance,
See, I'll share you my thing. So my parents, I got a Max Bupa. Okay. So that is, I got it for 3 years to take the waive off of pre-exit diseases. So I went ahead because the premium was around 1.4 lakhs, I think, 1.2 or 1.3 lakhs rupees premium. So they gave me sir, for sum assured of 10 lakhs, sir, 10 lakhs.
Okay.
10 lakhs, 1.2, almost 45,000 rupees per 40 or 50,000 rupees per 45,000 rupees per year, kind of a thing. So they gave me this credit card offer of no cost EMI. Okay, so it was EMI somewhere around 4,000. I don't exactly remember, 4,000 something like that. So I paid it for some 18 months. So I'm continuing that because that's already over now. So their renewal is next October. I'm continuing that 4,000 rupees. Okay, I've already accumulated close to 1 lakh rupees. I think 1.1 lakh rupees. So from that I got the idea.
It's good.
Sir, yeah.
The no cost EMI can be utilized here. I think that will work out for us because maybe a maximum 100, 200, 1,000 rupees we have to pay extra GST. Here for this thing we can, I think, use. Deepak bhai will allow me to do that.
He will again recommend to plan the SIP for future premiums.
Sir, yes, sir. Future premium I'm continuing, sir. Actually, that 4,000 rupees per month, I think I'm continuing.
Yeah.
Hello.
Yes, sir. Go ahead.
Hello, sir.
Ravi Kyadiggeri. This Pradeep.
Pradeep.
Nice presentation. Thank you.
Sir,
actually. Yeah, I thank Ravi Kyadiggeri for introducing me to Deepak Bhai. So I have learnt all the basics of financial this one from Deepak and Ravi Kyadiggeri. So it has helped me a lot, and also I could help my sisters and cousins also, and they also have started doing SIPs now, seeing at me this one. Thanks, Deepak bhai. Thank you.
Thank you, Pradeep bhai, for being part of family. We are all family. Ravi bhai, any closing comments? No questions.
Closing comment is yeah, one should have a health insurance. Okay, so better to start with a good coverage. I mean, good adequate coverage, and separate insurance for our and ourselves and kids. Okay, so that's very essential. And future premium, we should plan for our future premium. That's very, very essential. Okay, so that's what I can tell. And if any problems, our group is there. We'll learn from each other.
Thank you, sir. Thank you so much.
We can share the experiences also, so that we'll be learning that also. Okay.
Yes, sir. Yeah, that's an invaluable learning. Like others' experience, we are learning. That's invaluable.
Invaluable, but most reliable experience, most reliable information till we come.
Yeah, practical, most practical.
Most practical.
Yes, sir.
Yeah. Okay.
So, Deepak bhai and Ravi sir, can we end? Should we end?
Yeah, I think.
So last passing comment. Yeah,
You can conclude also.
Ravi bhai, really thank you to you for all the efforts. Thank you from bottom of my heart. It was a first-hand information, many terms which we did not know. That one thing I would tell you is that technical discharge, how exactly it works, the point. That is a trick which we all should be aware of. That these technical things, these practical things are very, very important. We should have the first-hand information from people like you, Ravi bhai. Thank you very much, Ravi bhai, for an extremely good presentation.
Sir, and one request, sir, Ravi sir, that can you share the PPT,
Yes,
sir?
PPT I'll share in the group only, sir.
Okay, sir. Okay, thank you so much, sir.
Okay,
Ravi sir, we are expecting more topics from you. Not
Yes,
only this one.
Sir, real estate ಬಗ್ಗೆ ಒಂದು ಮಾಡಿ, sir. Real estate ಬಗ್ಗೆ ಒಂದು ಮಾಡಿ, sir.
Real estate ಶನೈ ಸರ್ ಯಾರೋ ತಗೊಳ್ತೀನಿ ಅಂತ ಹೇಳಿದಾರಲ್ಲ.
Hello, Ravi bhai, we are losing you in between.
Estate management. Hello, estate management. ಶನೈ ಸರ್ ಏನೋ ತಗೊಳ್ತೀನಿ ಅಂತ ಹೇಳಿದಾರೆ.
He's maybe he's estate planning. He's thinking about estate planning. The will and estate planning.
Let this one conclude, then we can take forward.
First ಆ ಟಾಪಿಕ್ ಆಗ್ಬಿಡ್ಲಿ, ಆಮೇಲೆ ನೋಡೋಣ.
Okay.
I think one topic on this cyber crimes, cyber safety was also planned, no?
Yeah. But if people are interested, one speaker who is ready. Yeah. Because that is really
so many cases now.
Sir, very, very important in digital world.
Yeah.
No,
just 2-3 days. In just 2-3 days, many doctors here in our local this one, they are victims of frauds. All these cyber crimes.
They are two things. I think they are lured by big returns. I think, and so many things. I mean, if we give a review, we are going to give some 500 rupees like that. They are going to tell, and they this is what is happening, I think.
Basically, they try to create a situation of fear or greed. Fear is that they stun the individual at that time with a fear factor. I'm calling from this investigative department, or when a law enforcement person calls us, we will be stunned. It's like shocking that person. And in that duration, until we recover from that shock, they make us do the things which you are not ideally supposed to do. We know these are wrong things. We should not be handing over the things to anyone. this is very personal, CVV number nahi dena hai, OTP nahi dena hai. But in that stunning period, na, they make us do the things which we ideally would not have done in our sane mind. That is how their modus operandi is. Most common. Na? There may be multiple things. Greed is also there, but fear also is imbibed over there.
That is the like in medical term, that golden period will tell, no sir, immediately after the this one. So it is that one, like the cyber crime, when the event happens, there is
Yeah.
some 1 or 2 days to recover, like to ask someone or to get to know things on the internet
Yes,
and all.
yes.
Before that, they will start to extract money.
Yeah, and in the short period, na, they do multiple things. I have witnessed to real life examples right in front, and prevented too from happening there. So
Nice.
it can happen to any one of us. The best thing is not to keep more money in the bank account. One of the safest thing, which we can do actually.
Yeah, I think somebody should, like Deepak Bhai, should mention all these types of frauds and what are the preventive measures and what are the how we can prevent and how to respond if somebody approaches like that.
Another thing is people are flashy, na? They carry this credit card, debit card, na? At every shopping they're flashing this card, lo, swipe kar lo, swipe kar lo. I think we should stop carrying these cards physically. There are things where we can store them digitally and use them. We have access to smartphone almost everywhere. Wherever you go, the smartphone follows us.
No sir.
So we can install that cards on that, no, wallets. Like
No sir.
Samsung Pay is there. Samsung Pay supports credit card, debit card. Rupee credit card is now integrated in UPI. So instead of carrying that Rupee card flashing, na, at least we can put that Rupee card in the UPI and pay through credit card instead of paying through debit card. It's just not to earn brownie points or cashback and all, no? Credit cards. It is basically to protect our own interest. It is not our money, it is the bank's money which is at risk over there. And if we are proactive, the blame will be on the bank only then.
Deepak Bhai, if we are not carrying Samsung device or Samsung phones, the
Yeah,
problem in India is iPhone doesn't support other cards.
yeah, that is the problem. That is the problem. iPhone users, unless, because this is a problem going with Apple, and RBI. RBI wants the data to be stored in India. Apple is not
Yeah,
complying.
correct.
As usual, a US based heavyweight company. No?
Sir.
And
Better
India is
to
also doing.
Rupee card is very good actually. We can integrate with our
Rupee card. Yes. That is the Ravi bhai, that is the solution for this Apple Pay and all, basically.
Yeah.
Yeah, they did it. It's very easy. I'm using it actually. Most of the times I'm using it.
Yeah, people should endorse Rupee. Rupee is a homegrown network. Kick off Visa Master, and the benefits and advantage of Rupee are both for the buyer and also for the merchant, because the merchant discount rate is less for the merchant who has the swiping machine, so their profits also increase, and the money is not going out of India and getting sponsors to Master or Visa. The money is circulating within our own economy actually.
It's very convenient. Okay, the credit card. It's very
You're
very
using
convenient.
Rupee credit card, Ravi bhai?
Yes, SBI Rupee credit card I'm using.
Yeah, good. It's actually very good.
95% times I was using HDFC. HDFC hardly I'm using it. But Rupee card, majority times Rupee card, because online also it's very easy. If you go for a QR code, you need not enter anything. Just scan the QR code, enter. Just do it. Your transaction will be done.
Sir, HDFC also has
not
Rupee actually.
Yeah, all companies have Rupee card now currently because government has mandated them. Government is behind them with a cane. They don't need.
Every bank is issuing the Rupee card, but they are not actively promoting them. That's the only difference. Unless until we ask for it.
No, sir. What I did is I bought it from the Rupee online.
Certainly, yeah.
Nobody wants to sell it
online.
nobody wants to sell it.
Yeah, true.
Maybe banks are having nexus with this Visa and Master, maybe hand in glove.
They have
Might be.
commissions, sir. Maybe,
Banks are
yeah, they have commissions. Maybe there. Yeah.
commission is more actually. MDR commission is more because MDR commission, no, it divides between banks and the service provider. Okay, so there is a share between these two people, and many companies will come and approach us to purchase their POS, point of sale machine. What happens is if they are giving a discount, no, bankers will give on their part, they're giving a discount. For example, 1.5 rupees, 1.5% actually is MDR. In that, some people are ready to give it for 1.1 rupees also. So Master and Visa are taking their amount. They don't bother to look into them. But out of say 50-50, they're ready to 0.35% only. They are ready to swallow it and make a business.
Basically, they are reducing their margins to be in the business.
Operating margins they are reducing and acquiring the customers.
Volume, sir.
Yeah, volume-based business they are targeting.
Yeah. More the volume, they can also live with less commission.
Yes.
But at the end, we consumers should promote our homegrown brands and other things.
Of course.
Will pay.
We should try wherever possible, at least.
Yes. We should. In other countries also, rupee is introduced, but not to a widespread thing. Hope so it becomes widespread.
Yeah. And this UPI is spread like anything during the COVID time.
It's really awesome. Here also outside India, they are trying to introduce something like UPI, but not that efficiently.
Everything has come into one place, sir, actually. It was like good technology, the mobile boom, and safety.
Innovations.
All things has
Yeah, sir.
Yeah, that's right. Good technology it is. It's a very good technology with a robust technical backup. And mobile boom was there in India, mobile and data boom. And people, then the COVID struck. So all things have gone. I mean, it's a perfect recipe for a good economical policy.
Thanks to Jio, sir. Many people got Jio.
Jio. People use that Jio and they badmouth about Ambani's and other things.
Yeah. I mean, that was the best thing for internet banking, sir. Internet and to be that exposed to all this UPI things, no? Like internet was the main infrastructure which was needed.
Data revolution has changed everything.
Yeah.
Now in UPI there will be one more revolution. Now UPI is only supporting Indian numbers, no? Now in next couple of weeks, no? Even the international numbers from 4 or 5 countries will be supported, and it will be extended to even 18 countries.
Wow.
So NRIs who have bank accounts with Indian banks, even they will have that UPI and foreign inward remittances and all. So it will further boost the number of transactions and the economy also in that way.
Super.
Yes, super. Yeah. My personal experience, like now Shankranti shopping I went, all I paid through this Paytm and PhonePe only. Even this 20 rupees, 30 rupees, this one purchase, no cash is used.
This cash is primarily happening in real estate and gold only, sir, nowadays. Major chunk. All this small 10 rupees, 20 rupees is happening mostly through this UPIs only. Either PhonePe, Google Pay.
Chocolates, giving chocolates and all has also reduced significantly.
Yeah.
Yes, sir. The change chocolates. Every toll, no, they used to give one chocolate.
Yes, all that has been reduced.
FASTag is also really good, actually, very good.
Yeah. Now, if the GPS system is introduced, of course, they are just trying that with Bangalore-Mysore highway. That goes well, I think it still further enhances.
Salute to Nitin Gadkari.
Yeah.
It was there before only, but they have upgraded the technology themselves.
Anyway, but thanks, Ravi sir, once again.
Thank you, Ravi
Thanks,
sir.
Deepak sir, for holding
Thank
all
you.
of these things, all of the members, and planning these sessions.
See you all next week again.
And happy Sankranti to everyone who
Happy
is
Sankranti
celebrating.
to all. God bless
Wish
you
you
all.
all the same. Thank you all. Bye bye.
Thank you.
Thank you, Ravi sir. Thank you, Ravi sir.
Thank you, Ravi sir. Thank you, Deepak sir.
Thank you.
Thank you, Pradeep sir. Bye bye.
Thank you, Pradeep sir.